In a perfect world, a pregnant woman has easy access to healthcare. She attends a prenatal clinic close to her. She sees a trusted caregiver. She finds comfort in hearing the baby's heartbeat. All of this so that in 9 months, she holds her healthy baby with joy and fulfillment. But in many areas of the world, a pregnant woman's reality is anything but this happy scene. At the end of the 9 months, we witness this instead. Fact: 800 pregnant women die from complications of their pregnancy and childbirth every day around the world. In fact, if you go back to the beginning, you will find most pregnant women must go through pregnancy alone, with no guidance or surveillance. Fact: 99% of all complications result from no access to prenatal care. And when one young woman does make it to prenatal care, she is lost amongst a sea of other young pregnant mothers competing to see the one doctor or midwife assigned to the clinic. Fact: the ratio of patients to doctors is so high that most women stay home, resulting in 75 to 80% of women delivering at home with traditional birth attendants, most of whom are unskilled and illiterate. But MIMSI International envisions a world where care is brought to the pregnant woman. MIMSI's community volunteers enter the home with all the materials needed to turn the patient's home into a prenatal clinic. The prenatal mobile application works like this. A community volunteer inputs all information into the prenatal mobile app. Information gets uploaded to the cloud. Then, algorithms inside the cloud use the information to conclude the diagnosis of the pregnant woman and to beam this information back down to the community volunteer. In case the pregnant woman has a diagnosis which deserves more monitoring, the mobile application will send this information to a nearby hospital. The community volunteer can then accompany the pregnant woman to the hospital, all the while with doctors awaiting their arrival. The source of MIMSI's success is in training its community volunteers on the basics of prenatal care, taking blood pressures, measuring the height of the growing uterus, and listening to the baby's heartbeat. Volunteers are also trained on how to input this information into the prenatal mobile app and how to communicate with other providers their findings. With the training complete, the new MIMSI certified volunteers can go into the field and evaluate pregnancies while inputting this vital data into the prenatal mobile app. Outcome? A vibrant community with healthy mothers holding healthy babies. MIMSI International, delivering vital prenatal care to the doorsteps of pregnant women globally.